we're beginning at actually 4:07 p.m. I apologize that technical difficulties. Peds One and the Verden group and this lovely lady under my screen video here is going to be speaking today. So a quick bio about Susanne. Susanne's career has spanned across several sections of the healthcare industry. Prior to co-founding the Verden Group, she was employed by United Healthcare, I won't hiss or anything, in the area of physician network management, and spent several years as a healthcare consultant specializing in contract negotiations, business creation and development, revenue cycle remediation, vendor management, and process improvement. Formerly a practice administrator and billing manager, she understands the many different challenges facing practices today. She also owns and manages Patient Centered Solutions LLC, which assists practices with achieving patient centered medical home recognition, and independent practice MSO, a business solutions company, also known as IPMSO. She writes frequently and speaks regularly on the business aspects of healthcare and is often quoted in industry and media publications. So Susanne, you're going to go ahead and share your slides.
Share screen. Thank you for that wonderful introduction. Excellent. Okay. So today we're going to talk about how to add lines of services and businesses to your pediatric practice. This is the fun stuff. This is the stuff I really enjoy talking about versus more sort of dry subjects like contract negotiations. So this is a really fun one to do today. Okay, so let's see if I can manage to do this on my laptop. There we go. We're going to talk about a number of things. Developing new lines of services and businesses really means what can you bring into your practice that you don't currently have today. You may be doing some of these, you may be doing all of these if you're a large practice, or you may be doing none of them. Obviously, this is geared to those of you that are either doing some or none. But certainly at the Q&A at the end of this presentation, it would be great to hear from anybody that is in fact doing any of these programs and would like to share some sort of real life tips and examples. I will of course pepper the talk throughout with some of those, but it will be great to hear from those of you that are tuning in today. So really, when I talk about sort of lines of service and businesses for pediatricians, I'm really talking about things like mental health, ADHD support, obesity and nutrition programs, lactation, consulting, breastfeeding, asthma education, sports medicine, etc. And what we are really seeing is a lot of patient-centered medical homes that have gotten really good at bringing things like behavioral health, into their practice, lactation consulting, and a variety of other sort of educational programs. So as we go through these, I will be talking first about developing new services and then about developing new businesses. What's the difference? Well, the difference really are, services are sort of quick ads that you can just bring into your practice and sort of stand up some programs. Businesses are a little bit more comprehensive, and you'll see the difference here as we go along. I will try not to talk too fast today, but I am aware of the fact that we got a little compressed on our timeline with getting a little bit of a late start. So if I seem to be going along rather quickly, just jot down your questions and I'll be happy to leave a little bit of time at the end to answer those questions. So the kind of simplest, easiest thing to add to your practice are really sort of clinics, right, within your practice. So asthma clinics, nutrition clinics, adolescent clinics, all very easy to add, but they also present some great marketing opportunities. Also helps you with scheduling, of course, too, just because of the fact that you can now sort of, add these in outside of your scheduled patient hours. So what do I really mean when I talk about something like, an asthma clinic? Well, here's what others are doing. And this is sort of taken from a number of our different pediatric practice clients across the country in terms of how they've stood up some asthma programs. Now, some sort of officially call them asthma clinics and run them at certain defined hours of the day and certain days of the week. Others have just sort of like an asthma initiative, which they're sort of peppering throughout the day and just making sure that they are in-building little components to certain of their visits, obviously asthmatic visits, to make sure that they're comprehensively covering all of the things in their initiative. I do like the idea of asthma clinics, though, on defined days and times, and part of the reason why is because of the fact that you could bring in a certified asthma educator to assist with treatment, education, management, etc. This could be somebody that's already in your practice. It could be an RN or an MA or an LPN that takes some training and gets certified as an asthma educator. And that can be really beneficial, right? Because now it's not doctor time or provider time that is being spent with the patient, but rather you can see the patient and your certified asthma educator can actually assist in that visit and then take the time to really sit with the patient, make sure that they, understand obviously how to use their inhalers, understand about their medication and how to comply, with taking their medication routinely, et cetera, and so on. So really nice to do that. If you want to sort of go all in, then I'm recommending obviously call it a clinic, do it on defined days and times with a certified asthma educator. Yes, you can absolutely bill for these services, and certainly, improve your revenues. By the way, that's the goal for bringing in new services and new business, is definitely to improve your revenues, sort of diversify from just sick and well visits and immunizations, and also be able to, offer more comprehensive care to patients so that they don't have to go elsewhere for this. So if you're going to sort of go all in with this, if you've been thinking about, standing up an asthma program, maybe you want to go full Monty into an actual asthma clinic. If not, if you're not kind of ready to stand that up as a separate line of service and really promote that out to patients, you can simply start to add in some of these things. Now, obviously, most of you are doing a lot of this anyway, right? With your asthmatics, of course, you are, talking to them about how to control their asthma and medication monitoring, et cetera. But this offers sort of an opportunity to really just create a much more defined program so that all of your providers in the practice are all doing it the same way. Everybody's sort of following the same template, following the same program, and the patients really feel well supported in this, that you have a very good and robust asthma program. Of course, if you're going for patient-centered medical home recognition, or you are a recognized PCMH and you're maintaining your recognition, you could certainly use this as one of your quality improvement programs and obviously earn credit for all of the good work that you're doing there. Okay. Here's an example of an asthma action plan that I really liked. It's very simple, right? You've got a green zone, yellow zone, red zone, and it's put out by Children's Hospital St. Louis. There's a link here on this slide. The slides will be distributed if they haven't been already. You will be able to download these and maybe even copy and paste, from the actual slides themselves. If not, it's a little bit of a lengthy URL, obviously, but you could simply look this up at the Children's Hospital St. Louis. But again, just a really nice, quick, free and easy resource that you can use and incorporate as a sample asthma plan. No doubt, obviously, PCC obviously has asthma plans built into their templates too, that you could take a look at and incorporate into your visits. All right, nutrition. This is one that, isn't that widely done. Not wildly done. It's not wildly done either, but not that widely done. And part of the reason too is it can be a little tricky to get paid for a nutritionist, right? Also, how do you sort of define that, right? When would you actually have this program running on site? So here's what some others are doing. Basically having an on-site nutritional health evaluation by an independently contracted counselor, right? So instead of it being somebody that you have to hire and employ in your practice or take away from physician time, you may have a physician that can offer these services. But the idea here is that you want to do something that is going to be relatively defined at set times and where you can build volume, right? So if you had a particular afternoon on the week or evening during the week that you're able to bring in a nutritionist that could see, 10, 12, 15 patients, at a time or within that defined time, then you can run things like counseling services for groups. You can tie in community-based, weigh-ins and various other things. Alternatively, you could arrange to have a contractor there, during the day and just sort of schedule your visits, right, for those kids, maybe your pediatric obese kids at certain days and times, and then have the counselor there at the same time. So you could do your visit, charge out for that visit, et cetera. Then the counselor can come in and do those other services. Now, it isn't it isn't a huge ask, right? And it can actually be quite lucrative, particularly if you set it up around volume, as I mentioned. So how about an 8-month visit or a 21-month visit, right? So not even your pediatric obese patient population, but just those very young babies where you're going to work with parents to teach proper nutrition habits, right? Say you have 308-month-olds in a year, you can either bring in this nutrition counselor, or again, could be a nurse in your practice that gets some specific training in this, and you could utilize that person. Let's say your nurse payment is $50 or your counselor payment is $50. And you really want to sort of, time that out by the minutes, by what it is that you're actually going to pay that nurse or that counselor to come in and do it. And then what are you actually going to receive in terms of compensation, right? Not that hard to do the math, right? So 320-minute visits, right, minus the nurse's salary, could net you about a $12,500 profit. Where are we getting these numbers from? Really just sort of based on time-based counseling and component visits. But you can see how something like this could be done, right? When you group your patients together, when you really sort of concentrate on volume, and then you put together a very robust sort of service. Now, obviously, you want to promote it out there to your patients. You want to be able to have some good tools and good resources to put around a program like this. And so there are various programs that you can take advantage of. Again, some that are free, some that you pay a small stipend for. One that's very popular with our clients is www.letsgo.org. And they basically have a lot of materials that you can use. You can co-brand them, stick your own logo on it. There are various toolkits and things like that to incorporate into that. You can certainly also do this yourself, right? You don't need to hire a counselor. You don't need to, have a specially trained nurse. You could, in fact, incorporate some of this yourself into your office visits. Obviously, the caveat there, though, is that a lot of payers will bundle your visits together, right? So if you're doing something in addition during the well visit, it might just get bundled into the well visit. So that's what I'm recommending, is sort of a separate program to do this separately and get those different revenues. Okay, developing new services continues with adolescent clinics. So what am I talking about with adolescent clinics, right? This is really fun, and when done well, it actually really can be a great resource to the community. So adolescent clinics are basically seeing are sort of specific hours for teens, right? So on certain days and certain hours, like a Thursday evening, that's the time to bring the teenagers in for their well visits. Now, what's really nice about that is you can do a sort of a quick switcheroo. You could roll out certain teen-based magazines, right, that you could have in the waiting room, get rid of all the kiddie books, etc., and really make it feel like the practice is geared and oriented towards them, particularly during this time. I'm sure you've all heard or seen teenagers sort of bemoaning the fact that they're at the little kids pediatric office. So this is a really nice way, particularly if you have a fairly large teenage population, or you're about to stand up a program to recall teens that are overdue for well visits, immunizations, right, or if you're about to kick off a HPV campaign and you want to get teenagers into the office, this could be a really neat way to just make them feel very, very welcome and put around a sort of a range of services for them. Some of our practices have sort of very specific teenage rooms. So those are decorated obviously quite differently. You could do that, or you could simply switch out some of the art on the walls, right? If you have kitty posters up, you could just sort of switch those out for something a bit more mature. It's also a great way to get some programs in front of teenagers, brochures around, drinking and drugs and those sorts of things. It's great to sort of get them into their hands when they're sitting in the waiting room, hopefully not looking at their phones, or things that you can give them as they check in. But again, just with the focus being on adolescents, it's a great marketing opportunity too, right? To talk about having that in your office, and then really sort of catering and gearing that towards adolescents. It also helps with your recall programs, right? Did you know that we have a special, Thursday evening for teenagers? That sort of thing can also just help to gain traction and get them to come into your office. Obviously, adolescent well visits include things like, depression and substance abuse screening. And so it may actually help if you have a social worker or a counselor, or you're standing up a behavioral health program in your practice, to also co-locate that person or those services at the same time that you're doing sort of adolescent clinics. So some nice tie-ins there for you to consider. And then, of course, there's parent education. I love to use Kids Plus Pediatrics out in Pittsburgh as our sort of poster boys. Full disclosure, Todd Rowland, who runs Kids Plus Pediatrics, and his partner Al Wolf and I are all partners at the National Breastfeeding Center, but I promote them here for no other reason than just they do awesome parent education programs. Some of the education programs can be grant funded, right? So don't be afraid to ask in your community, are there any grants for parent education? And that can be, through local departments of health, that can be even payers, right? Insurance companies putting up and fronting some cash, or some local charity organizations. funds, but there could be some grant funding that really helps to build community and get some parent education out there. And that can be on anything from, and here you sort of see this, deck of educational services from KPP, sex, drugs, and Snapchat, not so new mom's coffee, kids and crafts nights, expectant parent orientation, et cetera, and so on, right? The sort of the sky's the limit for what you can do with your educational programs for patients here. You could also encourage local businesses to sponsor it, right? Is there a local Mimi maternity, store? You could ask if they wanted to sponsor something like expectant parent orientation, where they can, bring in their marketing materials or have somebody there to talk to parents. It all depends what your comfort level is, right, in terms of actually having sponsorships and sort of bringing in some corporate or consumerism aspect to it. But we have had some great success actually with some sponsored programs from local companies that are, interested in sort of building and fostering community. And or you could also charge parents to attend a fairly low amount. It could be, $10, $5, something like that, for in person, or even obviously in these days of COVID, doing something online, paid webinars. But again, very inexpensively, very inexpensive for the parents, so that obviously you can get uptake on these programs. But a great builder. Telemedicine. We could do an entire, presentation and webinar on telemedicine. I just wanted to hit 3 quick things for you, right? Where it was yesterday, where we sort of are today, where we're going tomorrow. Obviously, all of you, or most of you, if not all of you, have stepped into telemedicine thanks to COVID. And so obviously, COVID was a real catalyst for getting people to really adopt telemedicine and start using it for all kinds of things, all kinds of visits. Historically, we were sort of reserving telemedicine for things that were very cognitive in nature. Obviously, trying to do a well visit, via telemedicine when a kid needs, shots and weight check and various other things, is far, far less than ideal, and certainly can't be done. And so obviously telemedicine was used for things like, mental health, screenings, obviously, developmental delays and things that really were much more of a sort of a conversation rather than sort of a hands-on exam. However, you weren't paid for it, right? Most of the insurance companies had contracted with big box, like Televox type companies to provide these services. And patients basically were told to access it by their employers or by the insurance companies themselves as a member benefit, but they're talking to, Dr. XYZ. They're not getting to talk to you. So the uptick and the uptake on telemedicine historically was very little, very, very slow, right? Of course, COVID hits, everybody moves to telemedicine, tremendous growth, in this area. And of course, payers are paying for it. They're paying for well visits, sick visits, behavioral health, anything and everything they appear to be covering. And then also at no cost share to the patient, right? So no copay to collect. It's obviously very difficult for you to collect a copay when you're doing something virtually. They're not in the office. They're not checking in and handing you that cash over the counter. So we are seeing obviously a lot of benefits there. Some of the payers are paying at parity, meaning they'll pay you the same amount for an office visit as they will for a telemedicine visit, in person versus telemedicine. Others, there's a little bit of a difference in the price points. Some require certain codes. Others are saying just use your E&Ms. Where is it all going, though? Where are we going tomorrow? Well, a lot of the plans, and if any of you had tuned into PMI, Pediatric Management Institute webinar a couple of Thursdays ago, we had talked through, sort of very specific payer policies around some of the big payers like Cigna, United, Anthem, and so on. You can go over to the forum at PMI and get links to those latest policies. But it looks like a lot of those payers are trying to wind down the programs. At least the cost sharing component for the patients, for sure, is coming through this summer. And then some of the other payers are saying that their telemedicine, policy and access sort of ends, at a defined date. We are advocating, obviously, that the AAP, put some pressure on these insurance companies to allow telemedicine to continue to be provided by in-network providers, and also at parity with current rates. So, fingers crossed. But patients want the convenience. Employers want the convenience. That's what they're sort of paying for in a lot of these programs. They don't want it delivered by Televox if there's the opportunity to have it delivered in network. And now that we see that, in fact, that is relatively simple and easy to do for the payers just to simply pay you for that work, hopefully we'll be able to make sure that that sticks around for quite a while to come. Okay, so that's services, obviously. Things to add, things to consider, things that all have their own and generate their own revenue streams. Developing new businesses is a slightly different matter, however. While it's sort of easy to add in services, new lines of business are basically created with a couple of things in mind, right? One, definitely a revenue stream, but there's also investment that needs to be put into this, often in the form of hiring staff, maybe even expanding your premises, or at least using some of your existing space as dedicated space for some of these businesses. So let me tell you exactly what I am talking about when I say businesses. Lactation and breastfeeding center, that obviously, if you're going to stand that up as its own sort of center, you probably want to file its own entity. You want to be able to make sure that it's well resourced and have its own website and its own set of educational materials, etc. on there. Same thing with behavioral health and urgent care, right? You can certainly do after hours clinics in your existing structure. Many of you do anyway. As pediatricians, you're seeing patients in the evening, you're seeing them on the weekend, hopefully getting paid, though that really depends on where you are in the country and what sort of contracts you have. But the idea here is that a business sort of takes a lot more of your time and your energy and your resources to be able to sort of build out than simply adding some services. So you can either bring these, in-house through direct employee or through subcontracted professionals. I mean, particularly when we think about social workers, behavioral health, and lactation and breastfeeding, those are really great businesses to have subcontractors, so that you're not actually employing a person, paying their salary, benefits, etc., at a time when you're trying to build up the business. Much easier to sort of pay somebody a defined hourly amount. Sorry for the sirens in the background. And then obviously build the business over time so that the revenues can support that. And once you sort of have a full schedule, or you've built a business to the point where it makes sense to bring somebody in-house and hire them permanently, then absolutely have at it. And that's typically what we see happen with a lot of our clients, right? Starting small, bringing in sort of, services in-house, and then building that into a separate business over time. So what are some other people doing, other practices doing? Well, with regards to breastfeeding centers, certainly it can reside within your pediatric practice footprint, right? Or it can be a separate area altogether. Some of our clients, dedicate a specific room. Others dedicate a specific wing, right? Or build on, a sort of an area to their practices, or have it stand alone in a separate area altogether. We have had practices that have built out large breastfeeding centers in areas where there are a lot of babies, a lot of need, and a lot of demand for that. And it's its own, separate piece of real estate. So, again, it could be 2 rooms, 1 room, could be an entirely separate area. It's really handy to schedule the consultations alongside the newborn visit and or the 1-month visit for patient convenience, depending on where you're offering services. Often for newborns, a lactation consultant will go to the patient's home. So that's something obviously that could be offered. But having the lactation consultant available at the newborn visit is a really great way to do it, right? So mom only has to sort of bundle baby up once, come to the office once, is seen by you, and then handed off to the lactation consultant for a good in-depth newborn lactation consult. Any practice that has brought these services into their 4 walls have received all kinds of kudos from moms. It's a really essential service, one that's near and dear to my heart for sure, through National Breastfeeding Center, but is definitely a great practice builder. New moms love it, and it also fosters a lot of community, right? Where you could have new moms coffee, where they bring their babes, and you talk about breastfeeding issues, etc., and then that helps to build community, one mom to another, and that can be just such a loyalty builder, as well as just a really useful service. So even a small practice can be a breastfeeding center. Just so you know, I thought it would be neat just to pop up here a footprint and just sort of see what you can do. Add a lazy boy, a boppy pillow, baby scale right into the room, right? And you basically can have the newborn seen by the doc, and then the lactation consultant comes in and meets with mom while the doc or the provider goes off to the next patient. Okay. And then it becomes the newborn breastfeeding room with a dedicated room like that too. Obviously, with COVID and needing to clean everything and keep everything sort of, ship shape, it's great to just have a dedicated room for newborns. Okay. Behavioral health. What are others doing? Usually resides within the pediatric practice footprint, right? So again, within your 4 walls. You can certainly staff it with an employee if your practice population supports it. Practices that have multiple locations and high volume of teenagers in particular, adolescents in particular, seem to do really well with this model, bringing somebody in. The really useful thing about this is then you can schedule those patients. So you do your screening. You obviously, if you pick up on something, then you obviously can just hand that patient off to somebody that's already within your practice. Such a nice thing to have, rather than, oh gosh, we have to refer this kid out, who's under their insurance, who can we call, how quickly can they be seen, and on it goes. You guys all deal with that every day, so I know I'm preaching to the choir. But that is a really great way to do it. Now, rather than employing somebody, you could start small too. You could invite a behavioral health professional to utilize your office space after hours, right? You could even give them, free rent or very, low cost rent, etc. If you wanted to sort of, bring them into your practice and have them there and available to you. There's a, whole other webinar that we could do on, revenue sharing and how to make sure that you don't trip over the lines of certain regulations, kickbacks, things like that. But you can certainly email me offline if you're interested in setting up a behavioral health program, and I can give you a lot more resources and details from there. But this really does, as I mentioned, help, with where do you refer your patients. Keeping them sort of in-house is great. And just being able to, automatically set them up with that visit at the time of need for the patient obviously is tremendously valuable for the patients themselves. It certainly allows for better care coordination and access. And again, if you are a patient-centered medical home or you're moving towards your recognition for a patient-centered medical home, this is a great thing to bring into your practice for helping to achieve that recognition. And there is also a whole separate behavioral health designation that goes along with PCMH that can be worthwhile to achieve, not just for extra credit or because you want to, but also, again, to market that out to a wider audience and also engage with your fellow pediatrician colleagues, right? To see if they want to refer in patients for behavioral health services into your practice. You obviously don't retain them as a pediatric patient, but you would certainly be able to offer these services and then warm hand them back to their own patient-centered medical homes or their own pediatricians. Okay. Some ADHD program tools. So you'd start, with ADHD, you can start small. That's the other thing. Don't feel like you have to go large right out of the gate. You can certainly start small and just start with an ADHD program, start to build that up and see how you go. I've included a link here from CHOP, just so that you can see all kinds of program tools that are available to you just to help, get going on that, or even just to start thinking about the things that your patients may want or need. Developing an urgent care center, quite popular a number of years ago. What we're seeing now is more sort of an add-on to, evening hours and sort of adding on to what you're doing. And part of the reason for that, again, it's really highly dependent on where you are in the country, right? If you go to Texas, there's all kinds of urgent care centers everywhere. In fact, there's emergency rooms, freestanding emergency rooms on every other corner too. So very interesting depending what state you're in, as it concerns urgent cares, retail-based clinics, and various other things. Very popular in some areas, really not at all popular in others. But what I would say about an urgent care is, if you have urgent cares in your area and in your neighborhood, compete with them. I'll talk a little bit about that in a minute. Sometimes it's a separate building with a separate entrance, and that can often be a requirement too. So some payers will require that there's a separate entrance, a separate space, that you're able to meet certain criteria, like having an X-ray on site, being able to do lacerations, various things, and that you have certain defined hours for your urgent care. Others really don't have a lot of rules or regulations. Like if you're out in California, there's a couple of plans that will just let you list yourself as an urgent care if you're doing sort of after hours and offering certain services, and you don't need any sort of certification or accreditation. Other payers, even in California, will insist that you have to have some sort of accreditation in order to be recognized as an urgent care. So, do your homework, obviously call your payers if you're thinking about this, find out what the rules and regulations are around it. But if you are to do it as a separate business, you would probably set up a separate entity, and you may be looking for what are called facility contracts with the insurance companies, where they can pay you a global rate for urgent care services, but you would then, need to be able to provide X-rays and various other components, labs, some extensive labs, those sorts of things, in order to be treated like a facility under urgent care. Or you can go a little smaller, right, and just keep that under what we call a professional services contract. So certainly the hours around that are after hours. If you're standing up in urgent care, you obviously don't want that competing with your main business. And frankly, if you were to try and bill out urgent care when in fact those are your usual opening hours, that will raise some eyebrows, certainly with payers and your patients too. You definitely want to charge and bill for this, but be aware too that if you are able to contract as a separate urgent care, there's a different copay structure for your patients. So you need to really define the program in terms of how you explain that to your patients, letting your patients know that they, if they come in at 8 o'clock, you're in urgent care at 8 o'clock, you sort of switch over the businesses. The general practice closes at 5, you become the urgent care. If they're coming in at 8 p.m., there is a different cost share component that they would need to pay for that. So thinking about partnership versus competition when it comes to urgent cares, if you're a solo practice, opening up an urgent care makes no sense, right? But you may have some urgent cares close by to you, and that might actually help you in terms of getting to know an urgent care, getting comfortable with the level of service that they provide, and collaborating with them so that you have a place to refer your patients after hours. Obviously helps with avoiding burnout if you're, a solo doc, but also can be just really nice for your patients to know that there is a place that you recommend as opposed to them just sort of, finding an urgent care center or going to the ER. So that's kind of nice to have. And then it also means that you're going to get good information back from the urgent care. And so they'll keep you, in the loop of what is going on with your patients. But also, I would encourage you to compete if you're larger and you can, right? Why let the urgent cares and the retail-based clinics, pick off your business, right? If you can compete and keep that business, definitely do that, right? So, if you're a medical home, you can, offer those extra hours. It allows you to provide more comprehensive care within your medical home, and obviously avoids that sort of fragmentation of patients just going elsewhere. A couple of other points, just in terms of competing, right? Rather than the urgent cares picking off your business, start picking off their business, right? Let them be more concerned about you, not just retaining your patients, but then advertising it out to the wider community that you're an urgent care, you're an actual pediatric urgent care, right? Most of these urgent cares are not pediatric focused unless you're, PM Pediatrics or one of those other sort of, specific after hours pediatric chains. But they're not popping up everywhere, right? So if you just have a general sort of urgent care retail-based clinic that's sort of marketing to pediatric patients, then obviously your message, your marketing needs to convey that you are the pediatrician. Why go to an adult doctor, take a kid to an adult doctor when you are open and you're in urgent care? So that's really that's a really good, I think, point to make with your patients. So you're going to differentiate yourself on customer service. You're absolutely going to promote this to your own patients, but then you can actually message that out to the wider community that you're in urgent care and they can come to you after hours too. But do your research before undertaking any line of service or business, right? You can certainly ask your patients what they need. You've got hundreds of patients coming through your office every week. Well, not right now during COVID, but you are touching, scores of patients every week, either virtually or coming into your office, more and more coming back, obviously, every day. So just hand them a short survey. If we were to expand office hours, what would be the most convenient times and days, to do that? And let them tell you. It might be Thursday evening, 6 to 8, right? So that would tell you don't bother standing up a program on Monday nights, right? If patients feel like Thursday nights are when they would, most want to come in. So ask your actual patient population. Tell them, is there a need for lactation services? Look at the number of annual births, right? Dig into some of the statistics. So do your market research too, is really what I'm saying. And then also, just find out from your patients just in the form of an open-ended question. If we were to add more services to our practice, what would be most useful to you? And see what they tell you, see what they jot down on that piece of paper. I would encourage you to do it on paper, right? Because you have patients there checking in. You can slip a, quick 2-question, 3-question survey under their nose and garner that back. You can take a quick thumb through and see what is sort of, popping out. Obviously, you can tally all of those up too. But my point here is that you get a, almost 100% response rate by asking the patient in front of you to complete those questions, rather than sending an email where you might get a, 3% response rate. Who has the time, or who wants to make the time to answer a survey, that comes into their inbox. Whereas when they're in your office and they're checking in, they have the time, they're standing right there, they'll take care of it for you. Okay. All right, so utilizing payer resources. Believe it or not, the insurance companies sometimes get it right and are able to help offer some support and guidance on some of these programs. I had to throw in, a jab at the payers, of course. So this is just a cute little, you're suffering from a serious medical condition called lousy insurance, right? So while I'm poking fun at them, I'm also going to put in front of you some of the tools that they have undertaken to develop and put out on their websites and make useful for, for you as an in-network provider. Just keeping an eye on time. I think we're doing okay. So Aetna, for one, has an integrated primary care behavioral health program. What's nice about that is they actually sort of, have put out a little checklist, of things that you can do to be able to bring a program like this into your practice, right? Everything from lease agreements to location to times to be available to how to schedule those appointments. I've obviously included the link at the bottom for you, but that's nice just to be able to sort of look at workflows and figure out how you might integrate something like that into your practice. And then, of course, they pay you for it. That's the key thing here, right? So they basically are looking for behavioral health clinicians. They're clearly defining for you what those clinicians are. I don't know if you can see my mouse underlining and underscoring something here, but on the side of this slide where it says billing guidelines, they've defined behavioral health clinicians as licensed psychologists, either master's or PhD level, licensed social workers, master's level minimum, or licensed professional counselors at master's level minimum, right? So if you are going to deliver those services, they're definitely looking for you to have a behavioral health clinician to do it. They give you the diagnosis code for it, the procedure code for it. And just FYI, the procedure code is close to 3 RVUs, right? So that is, I think, equivalent to a 99213 or 214. So again, sort of on parity with what you might expect for your E&Ms. Actually, I'm pretty sure it's 99214. So that pays $106 CMS national fee schedule. So if your fee schedule is on a Medicare basis and you're, say, getting paid 100% of Medicare, you could expect about $106 for that visit. Okay, so pretty nice. Anthem, Blue Cross Blue Shield, there's 16 or 17 Anthems across the country, so they're a really large book of business. They basically have a condition care, they call their program. They are able to have you connect your patients over to them for various education, round the clock phone access, guidance and support from nurse coaches. It saves you time, obviously, for somebody that may need to be chronically managed. You just need to ask yourself if you really want to do something like this. I've talked to a lot of pediatricians across the country, and some say, look, the last thing I want is for a payer to be giving my patient any sort of, clinical advice. But here's the way I view this, is sort of that there is a team that can extend the support. So particularly if you're a solo doc and you have, patients that may have high need care or, a substantial number of, Anthem patients, you might actually want to just see if you could take advantage from this. Call them up, talk to them, see what are the education that they're giving out, what is the guidance and support that they're doing. And if it fits philosophically with your own, clinical practice, then certainly this is a great way to sort of, extend what it is that you're able to take care of. Humana has case management and chronic care programs, same sort of thing. Obviously, a lot of this applies more to sort of adult medicine, but certainly we do have a certain number of pediatricians that are taking advantage of these sorts of things, like medication adherence. Where this is particularly useful is if you're in a value-based contract, right, where you would be getting dinged on things like patient refills, medication compliance, and certain other metrics, right? Being able to have an actual insurance company that is grading you on those things and paying you, on those things, be part and parcel of helping keep a patient on track, can be really very useful indeed. Okay, United Healthcare Oxford has a 24-hour nurse hotline. Again, particularly if you're a solo doc, right? Just having that sort of, on call can alleviate some of the call burden from you. And then CDPHP is fairly local here to upstate New York, but they have some nice tools to combat childhood obesity. So, if you set up a nutritional program or a weight management program in your practice, there's a bunch of tools and things here that you can pull down and utilize. Most of these, by the way, are sort of open source. They're not behind a login wall for these payers. So even if you're not an in-network provider for certain plans, you can still pull down these tools, use them, or rebrand them, whatever you want to do with them. But that can be, just really useful to help you very quickly get the resources and marketing materials and educational pieces pulled together relatively quickly. And then funding for these things, as I mentioned, grants are a great way, particularly for like parent educational programs. Always check out the aap.org grants database. There are grants that hit there routinely. You should maybe just sort of sign up for that, or set a time once a month to spend a half an hour just going through the grants database and seeing if there's anything useful and appropriate there for you. We've had practices that have been awarded very small grants, like a $500 grant, but it's been enough to get a program stood up without digging into your own pocket. Other practices have had success with obtaining much more lucrative grants from payers and other places to be able to stand up very robust education and sort of monitoring programs. So take advantage of that. I'm a big fan of change. I think the best way to cope with change is to help create it, right? So don't wait for a competitor or a practice locally to start to implement these programs, and then you're sort of playing catch up. It is always good for you to be out in front of that change and help create the change that's coming. Okay, so we're just shy of the 15-minute mark for Q&A. So I hope I didn't speak too quickly for everybody, but again, everything's written down there on the slides. I tend to put a lot of words in my slides so that you have something to refer back to. But I think it would be great if we had an opportunity to do some Q&A, and I will turn this back over to Lynn to help with that.
Hey, you're still sharing though.
Let me stop sharing. There we
Looks
go.
like that's okay. So, right as of now, we do not have any questions for you. So you did rush right through. Man, I was like, man, she's talking like John Canning speed.
Well, I've
Um,
lived in New York so long. I'm Irish, number one, as you know, and then I've lived in New York for so long that it's just impossible for me to speak slowly. So, but I did not want to compress things. If people did have questions,
Yep.
certainly there are questions that pop up, after the fact. My contact information is there. People know how to reach me. They know where to find me. I'll be happy to answer any follow-up questions that anybody may have.
Oh, okay. So we have a question from Allie at PCC.
Okay.
How can providers form a payment salary structure for new consultants or experts?
So in terms of like bringing in, say, like a nutritional consultant or a lactation consultant.
I'm going to guess that's what she meant.
Okay. Um, yeah, so don't do it on a sort of a per patient basis, right? Some practices say, "Oh, I'll pay you $25 a patient," or this and that. It may seem like that makes sense, but it really doesn't. The other thing to not do is cost sharing or fee splitting, rather, where you say, for each patient, I'll give you 50% of what I make off of that. And the reason why is because it just flies too close to this idea of kickbacks. So what you really want to do is just establish, what is a market level appropriate salary for, say, a lactation consultant. Contract with them for those set period of hours, and it's up to you then to schedule those patients, right, to be able to make sure that the consultants, that good use is made of her time. That does a couple of things, right? One, it's fair. It creates fairness. The consultant knows how much they're going to get paid for how long they're there, an hourly rate. It also alleviates the pressure of, well, if I'm paying you per patient, but one was a Medicaid patient and another one is a commercial patient, you just sort of get into all kinds of mess that way. So we tend to just say, set an hourly rate, set up the hours, schedule the patients appropriately. It also means that you can then manage that schedule, right? So as patients are calling in, so you're scheduling a newborn visit, and then you're looking at the other schedule for, provider lactation consultants, and able to pop them right on the schedule, right? So it's very convenient to do that, as opposed to doing it a different way, where a lactation consultant is saying, well, I'll come in, at different times. If there's patients that need to see me, that's fine. And maybe there is, and maybe there isn't. And it just is a bit of a mess, right? So you want to just be able to define that as an hourly rate, and contract that way, same as you would for anybody else. Now, one big thing to underscore, though, is what makes them a contractor versus an employee. Well, usually they have their own business. They're seeing patients at other practices, or have their own particular business and their own book of patients themselves, and so they have their own tax ID number, etc. You're writing a check to them for whatever that hourly rate is. They're filing their own. They're a 1099 contractor, basically. You're not in control and overseeing them necessarily in terms of directing them the way you would an RN or somebody else in your practice as an employee. So that's good and safe to do. No problems doing it that way, but just put a formal agreement in place between you to contract that person, so it's very clear that this is an actual contractor, 1099 contractor, and not somebody that a more sort of employment type relationship. The Department of Labor might view that as more an employee type relationship. You want to be able to stay away from that.
I believe that is all we have for questions.
Okay.
So, but again, people have your contact information on the slide. We did share the slides with them at the beginning of the presentation. They'll also be on obviously pcc.com/uc-2020 for everyone to be able to see. Thank you so much for your time. That was interesting.
Excellent.
Thanks. I always enjoy watching your sessions during the users conference. So it's nice to be able to do it virtually as
Yes,
well.
it's great to be able to do it virtually, but so sad not to be able to see people in person this year. So
It is. So yeah, don't forget the big bash.
oh, that's so fun. Okay,
Yeah.
I will put that on my calendar.
All right.
Fantastic.
Cool.
Thanks.
All right.
Thanks.
Thanks, guys. Bye
Bye.
bye.
Bye bye.